So basically it was very extreme.
Yeah.
And I used to tell my mom, I'm having a lot of pain, and it's not the discomfort, it's like pain, debilitating pain.
Yeah.
And one of the things that stood out at that time was that my mom was like, hizi ni mambo ya wanawake. This is what women have to go through. So I for some funny reason, I never used to get my periods when I was home for the holidays.
Okay.
Until one time in Form 3, I think it was April there, I got my period when I was at home. And then my mom was seeing me crawl to the toilet. Like I couldn't walk. It was, hey, have you ever seen a woman wail? She's like, what is this? Oh. Is this dream on possession?
Not my daughter.
Not my daughter.
Yeah.
And she asked me, is this what you've been going through? And I'm like, yeah, this is what I've been going through, but it's normal, right? As in everyone goes through this, right? Yeah. Hey, the way I found myself in a gynecologist office that day.
Oh.
Yeah, so shout out to Dr. Salome Waweru, who helped me through that journey. And she basically educated us and said, this cramps or dysmenorrhea. Dysmenorrhea is painful cramps. Yeah, painful periods rather. Is common, but it's not normal. It's common.
Repeat that.
Ladies. Ladies.
ADHD girl.
So painful periods is common. Yeah, but it's not normal. Yeah, it's not normal. Discomfort is one thing. Yeah. Debilitating pain is another. Yeah. So it's not normal.
Okay.
And if you have such, it needs to be investigated promptly.
Yeah. Hi guys, welcome back to A Dose of Health, the podcast where I give you not too little, not too much, but just enough information to help you make an informed decision. My name is Dr. Hope. I am the host, and today I have we're at school together. A friend, a doctor, a yapper. I think if there's one person who can out-yap me, it's her. So let me let her introduce herself, and then we'll start the conversation.
Thank you. That introduction was, honestly, it's enough. It has described everything.
Because I haven't even said your name, by the way. Know that.
Oh, yeah. Okay. Let me start from there. My name is Kendi, Kiogora. I am a medical doctor. I am a health center manager at AR Healthcare. I am a budding health policist.
Hey, I had bad. You're like, yeah.
Yo.
Hey.
Yes, I'm a budding health policist with specializing in health leadership, governance, and system strengthening.
Wow, big words.
Yes, big words. Yeah, but those are just my 8 to 5 titles. My 24/7 titles is that I'm a baby girl. Crockett. Mini last born mama, mina daddy. Yeah. Come on, unite. Womb closers.
For real, by the way.
Yes.
Yeah.
I am a sister. I am an aunt, a title that I also hold very dearly.
Yeah.
I am a friend.
Too many.
I am a cynophilist, a dog lover.
Okay.
And
let me tell you. Let me tell them, first of all, we're having a conversation before because there's a cutie dog. He's outside here. Yeah. And she said she's a cynophilist. Me, I was there thinking, okay, Anopheles mosquito. Where do we go from here? But I've learned a new word today. Cynophilist. Yes. I'm a heliophile. I love the rain.
Yeah. Fantastic. You have to prove that you know these words.
It's true, by the way.
Because we went to school.
Yes, we did.
Yeah, so you have to show that you went to school.
Yes. Yeah. Correct.
Yeah.
All right. Happy to have you here.
Thank you for having me.
How are you feeling today? We do a journey to Inside Out. So where are you mentally, emotionally? How are you feeling today?
Today, I am calm. I don't know if I should say calm because someone out there would be like, is this calm? Is this calm?
It is.
Yeah.
Yeah, it's your calm.
It's my calm.
Yes.
Yeah. So I'm calm. I am happy. Yeah, I'm centered.
Yeah.
Yeah.
Wow.
Yeah.
Wow. Okay. Me, I'm peripheried.
Yeah.
I'm joking.
Did you get it? Did you get
I
it?
know. Actually, if you didn't, please. The periphery.
Yeah,
She's
the
in the center.
yeah,
I'm periphery.
in the periphery.
1, 2.
Yeah.
But it's so nice to have you here. I think, when was the last time I saw you? It's been years.
Doctor Talks.
Oh, random doctor talk.
yeah,
Shout out to
random-
them. Hey, girlies. Yeah, actually, that
Yeah.
was 2021, I think.
Yeah. Yes,
I think
actually,
so.
20. Oh
It
my
can't
God.
be 20 because that was internship.
Yeah.
So 2021.
God, 5 years ago. Our
Time
age is
flies.
showing.
Time flies. If you got a child by then, now they are 5.
5. Ako kindergarten.
Wanamaliza you under 5.
Oh no.
What? No. Oh yes. What do
Oh,
you know?
oh yes. Yeah.
They made it out.
They made it out.
Yeah.
We thank God.
But yeah, it's so nice to see you. And the topic we're speaking on today, I think, is related to what we talked about back in the day.
Yes.
Yeah.
Yeah.
Okay. Now, before we get to the topic, just some random questions.
Okay.
We call this a doctor seat. Okay.
Yes.
There'll be some music here. Do-do-do-do. The doctor seat. Don't overthink it. They're just simple questions.
Okay.
Okay. So, if you had to explain to a 4-year-old what you do in like 1 or 2 sentences, how would you do it?
Okay. My nephew is around that age.
Okay.
So usually what I tell him is that I am going to work so that people who have ouchies can stop feeling ouchy. Yeah. Yeah.
Okay.
Yeah.
Correct.
Correct.
Next question.
Yes.
If you were to rate your top 5 medical specialties, how would you rate them and why?
My top 5 specialties. Well, of course, the one I want to go into, which is health policy.
Thank you. You know, many people who are in clinical don't really consider non-clinical as specialty.
Yeah.
Okay.
So, yeah, non-clinical specialties, like now
They're all
health policy, is numero uno.
Okay.
Yeah.
Correct.
Yes. And then now we, probably psychiatry is number 2.
Okay. You actually wanted to do psychiatry at some point.
Did
you?
yes.
I feel like you're interested.
I was passionate about
Okay.
mental health.
Okay.
What did you
I'm
say,
passionate
babe?
about sleeping.
Yeah, come on.
Okay.
So yeah, psychiatry would be number 2 because I feel like they are a very underrated specialty. And those people deal with the mind, and the mind is it's fire, baby.
Hey.
Yeah. Number 3 would be pediatrics.
Okay.
Because children,
I think you do well with kids.
children can't explain themselves very well. So it's up to you to dive deep.
Yeah.
Because a child won't come and tell you, oh my God, fever. Oh my God. No, it's up to you to, if they tell you they have a headache, it's up to you to take the temperature and be like, oh yeah, that headache is coming from a fever. So if you're not a very keen doctor, if you're not like an inspector, you can't be
Inspector Mwala.
Inspector Mwala. You can't be a pediatrician.
Yeah.
The 4th thing I think is surgery, any surgical specialty, mostly because their patient is on the inside. Let me put it that way. The patient's on the inside, so they have to go in and they have to like tough, you know. Yeah. The 5th specialty, maybe pathology.
Okay.
Yeah.
Another underrated one. Yeah.
Pathology. Because those people, they work behind the scenes and they're the ones who write reports and they're like, it's abnormal.
Yeah. Anywhere your biopsies are going to, it's a pathologist who is reviewing them.
Yeah. So and they hold a lot of can I say almost final says. Yeah, so they have to really
that's true.
give it their all.
Yeah.
Because if you go and tell somebody there's no cancer, and then there's cancer.
Yeah, even just a small, cellular change. Yeah.
It's a wrap.
That's true.
Yeah, that person will be like, I'm cancer free, woohoo. Then like in 2 years they're not here with us. So so I think it's something very underrated. Yeah.
Right. Those are nice ones.
Yeah.
Next question. If you won a grant today, what are you solving? What problem are you solving?
Other than buying out our government.
Hey, that must be a big grant. Ginormous.
Okay.
And why are we buying them out?
Because I feel like our government is made out of watu tu wako na pesa.
Okay.
You know, so if you have money, government
speaking their language.
Is where you should be, you know. So I think I can just buy them out.
If you have, or if you're looking for
a grant,
quick money.
Oh yeah, if you're looking for quick money,
which should not be the case.
So I think I'd just buy out the government. I'd be like, unataka nini ngapi? Shika square.
And you're like, table.
So I'd buy them out,
and
then I'd just build like a government from scratch.
Okay.
Yeah, I'd be like, well, are you qualified? Ulienda shule? The papers? Okay, you can come in.
Correct, the papers. Yeah. Are we registered to vote?
Nico Cardi. I'm so ready.
Yeah.
Because the last election, I was working. So
Even me.
Yeah, I got to the polling station just a few minutes after closing time.
Oh.
And then now my dad blames me for the state of the country because I didn't vote.
Yeah.
And I'm like, bruh, you know.
It wasn't sikwenda kwangu.
But the next election, I'm going to be there 6 a.m., 6 a.m.
Yeah.
Niko hapo. Yeah.
Tunafungua na tunakaa hadi you eat breakfast.
Unaka huko.
Because kuna extra job.
Yeah. To make sure, you know, things are not stolen.
Yeah, we are moving well.
Yes.
I think even me, I didn't vote the last one because I was in Karatina and my voting station is in Nairobi. And I know you're going to say, yeah, you could have changed. But I was like, I'm not going to be there for a long time.
Yeah.
So it was just one election cycle. Yeah. Okay, next question. What's one skill that you think you have that makes you a good doctor?
A skill or a trait?
Or a habit or a trait.
Or a trait.
Yeah.
I'm compassionate. I'm compassionate. Like, me wanna feel.
Okay, that's good.
This is what I usually say.
Yeah.
By the time that person has come out from their house and they've come and they've been like, you know, I'm not well, something is wrong. So you just extend grace to them and have compassion. Even if it's a small, tiny flu, it's making them uncomfortable. And nobody wants to be uncomfortable.
Yeah.
So I think that compassion, that empathy has brought me a long way with my patients. Because now that one just makes me now like not write notes when they are speaking. You know, those small things.
Like you're actively listening,
asking them questions, you know, asking them if, you know, they have cows. You know, those small things that make a difference. Yeah. So I think that is one of the things that, you know, I have. And that it's what I've been told anyway. Let me say that. It's what I've been told.
You don't have to... sorry. You don't have to toot your own horn.
Yeah.
Karibu ni nyongo hapa.
Whoa!
Check me out.
So, you need to choking my throat steam.
What is that?
There's also...
Girl, come back.
Okay. ADHD guys, unite. Okay. I hope to touch
Oh my goodness, what did I want to say? No, I wanted to say, especially when I was in an outpatient setting, I used to be like, you've come for a homa, like just a flu. Or like, what do you mean the baby has been crying the whole night? I don't think I used to like understand like how that can be very distressing to a parent. Until I think this one time, now when I hear like my nephew crying and you can't find out why they are crying, I get it. Like as a parent, you've tried everything and the baby is still like crying.
Yes.
So I think even me, empathy is something that I've really learned. And I don't think it's something that comes innate for everyone. Like you have to be intentional about it. Okay. Sawa. Sasa kumaliza before we start now the conversation.
Yes.
Our episodes come out on which day of the week?
Wednesday.
Correct.
Kuna zawadi.
See me later. See me after this.
No. That one is an obvious thing because to me subscribe na tukaeka ile kakengere.
Now actually, let's invite people to subscribe right now.
Yes. Okay, listen. This is just me. This is what I'm thinking. If hope has helped you in one way or another, the least you can do is just subscribe.
Yes.
It just makes sense.
It's free.
Yeah, and it's free. Hatukuitishi mado.
Imagine.
Yeah, so just...
Kapush tu ka.
Yeah.
Okay.
Yeah, because you're umesaidika.
I hope so.
Hope has helped.
I
H.
My mother is so happy. She's like, yes, I knew naming her Hope would be a good thing.
Yeah. Yeah.
But it is, by the way, because it's such a cool name. Yeah. Okay. Now, because the episodes come out on Wednesday, and we are trying to be patriots of our very great nation.
Yes.
So, kutumia lugha ya taifa. Tueleze mada ya leo.
Keke. Mada ya leo tunaongea kuhusu wanawake, damu yao ya mwezi, na shida zinazotokana na damu yao ya mwezi.
Correct.
Hallelujah.
Hongera.
Thank you. Nimejaribu.
Mwalimu wa Swahili, he's smiling or she's smiling wherever they are.
Yeah. Mrs. Onyango.
Aww. Shout out to her.
Yeah.
So, because this episode is going out on or around the week for World Menstrual Health and Hygiene Day.
Yes.
So we just wanted to take this conversation a bit higher or deeper.
Yeah.
So usually when we talk about menstrual health and menstrual poverty and menstrual health issues, many a times it's very at the surface. So we talk about the products and we talk about, is it heavy? Is it not? Do you have cramps?
Yeah.
But now let's go a bit deep. We want to extend to the menstrual health problems. So we call them period problems.
Yeah.
But before we go there, Ebu, tell me about your experience being a woman, a menstruating woman. How has that been? I remember from back in the day, you're the crampers of the crampers.
Yeah.
Hey!
I'm still a cramper.
You're still a cramper.
I'm still a cramper, but a cramper who is getting help.
Okay.
So that's a good thing.
Yeah.
My menstrual journey has not been easy since menake. By the way, menake. Menake inamaanisha juu niliambiwa na hope hapa I have to explain.
Oh yeah, that can be your medical jargon.
My medical jargon.
Yes.
So menake means your first period. Yeah. So my journey has not been easy since menake. It has been painful and it has been bloody.
Yeah. It's a sad reality.
Yeah, very sad reality.
Yeah.
So it was one of those things where I couldn't even articulate myself because I was not sure how I was feeling. So you're there vomiting and you're, having diarrhea.
Yeah.
And then you have moods from here to Timbuktu. 1 minute you're crying and then the next minute you're telling someone you love them. It was so extreme.
Girl, who is he?
If you're watching this, do not reply in the comments. So basically it was very extreme.
Yeah.
And I used to tell my mom, I'm having a lot of pain and it's not the discomfort. It's like pain, debilitating pain.
Yeah.
And one of the things that, stood out at that time was that my mom was like, hizi ni mambo ya wanawake. This is what women have to go through. So I for some funny reason, I never used to get my periods when I was home for the holidays.
Okay.
Until one time in Form 3, I think it was April there, I got my period when I was at home. And then my mom was seeing me crawl to the toilet. Like I couldn't walk. It was, hey, have you ever seen a woman wail? She's like, what is this? Oh. Is this dream on possession?
Not my daughter.
Not my daughter.
Yeah.
And she asked me, is this what you've been going through? And I'm like, yeah. This is what I've been going through, but it's normal, right? As in everyone goes through this, right? Yeah. Hey, the way I found myself in a gynecologist office that day.
Oh.
Yeah, so shout out to Dr. Salome Waweru, who helped me through that journey. And she basically educated us and said, this cramps or dysmenorrhea. Dysmenorrhea is painful cramps.
Yeah.
Yeah, painful periods rather. Is common, but it's not normal. It's common.
Repeat that.
Ladies.
Ladies. ADHD girl.
So painful periods is common. Yeah, but it's not normal.
Yeah.
It's not normal. Discomfort is one thing.
Yeah.
Debilitating pain is another. Yeah. So it's not normal.
Okay.
And if you have such, it needs to be investigated promptly.
Yeah.
Sooner rather than later. So I started my journey there with Dr. Salome Waweru. And she got medication and all that. And then at some point, we now escalated because now the cramps were still there.
Yeah.
The heavy bleeding was still there. So we escalated at a particular point. Can I say it got better? Yes. because right now I'm not crawling,
Yeah.
to the toilet.
Yeah.
Now I can, and of course with the medical knowledge, I can now take care of myself in terms of the pain and the heavy bleeding. But it's still there.
Okay.
Yeah. So it has been quite a journey.
Yeah.
Yeah.
Okay. And what are like your favorite period products? I know we talk about period products. Yeah. What are your favorite period products?
Sasa.
Oh, which ones are the ones that have worked for you? You know, sometimes it might not be your favorite, but it's what works.
Okay. So, mi nitasema tu hivi. Anything that induces my comfort, for example, I don't have to keep on changing.
Yeah.
All the time.
Oh, menstrual cup.
Yeah. Okay, well, I've never tried a menstrual cup.
Okay.
But this very huge maternity pads. I must say it here.
Yeah.
They are very convenient because these kawaida pads, within 3 hours, you're like, excuse me. I have to use the bathroom. Yeah. But these maternity pads are very efficient in terms of keeping you a longer time from, going to change.
Yeah.
And also adult diapers.
Adult diapers?
Yes. They work very well, especially at night.
Okay, yeah, I can see that.
Yeah, at night. Because during the day, you just...
Hey, Kendi, wow.
You're like,
the hips. Shakira, is that you?
Lie. And you're like, oh. Well, see what happened was... So those maternity pads, I mean, they work really well.
Yeah.
But other than that, I think the industry is becoming very aware, because nowadays people are now turning to 100% cotton.
Yeah.
So the cotton products are there, which is very good. So the pads are still my main.
Okay.
They're still my main go-to.
Yeah.
But I'd like to try period panty. I've said it here in this podcast. I'd like to try a period panty.
Okay.
Because I've seen people wearing them. Yeah. And they're like, oh yeah, it's comfortable. And they don't leak out. And I'm like, what do you mean?
I think maybe now you have to start in stages.
Yeah.
And then you'll have to change more frequent. You can't change.
You can't change.
No,
Yeah.
you waste the whole day.
Unatoa nyande completely.
Wait, let me ask a question.
Yeah.
Okay. In my head, a period panty, it's like it's just padded with extra cotton so that it absorbs.
Yes.
Is there anything at the bottom to like protect you from leaking, or how does it work?
I don't think so, because the last time I looked at it, it was via Google.
Yeah.
It's just aleka.
It's nguo,
yeah, it's a nyande. Okay. It's a nyande like any other.
So I would suggest try it at home first, like when you don't have things to do.
Yes.
Because you said your periods are heavy.
Yes.
Yeah.
So I'd probably try it on day 4 or 5.
Yes. Okay.
Because 1 to 3 is demonic. It's demonic.
You feel like asking, is there any blood left in my body? Yeah.
Yeah.
Okay.
Yeah.
What about tampons for you?
Now, ever since we learned about, is it called shock?
Toxic shock syndrome.
Toxic shock syndrome. And it was such an innocent day in medical school.
Yeah.
We just went to class, and then we were told, did you know that tampons can kill you? And I was like, what do you mean?
Yeah.
So ever since that lesson, I was like, nah. Because what happens is, again, tampons with heavy periods, you have to wear a pad anyway.
Okay.
Because it'll just rip
leak,
out. Yeah. So, tampons. Okay. It's not my go-to. Yeah, but maybe when I'm swimming or something of that sort, or playing a sport. Yeah.
Correct. And now that you say swimming, I keep telling people that, okay, depending on your flow, like for me, my flow is not so heavy.
Yeah.
So a tampon can suffice. So I can swim with one and it won't leak into the pool.
Okay.
And then also...
I'm listening.
An extra layer.
Yeah.
Even if you're not wearing a tampon.
Yeah.
Remember, what is it called?
Yes.
No, once it's floating.
Oh, okay. The
differences in pressure. Because of that.
Yeah.
If your flow is not so heavy, you really won't leak into the pool. I've swum before without a pad, you can't see the pad, without a tampon. Yeah. It didn't leak.
Must be nice. Sisi ni watu wa Red Sea and above.
Red Sea. That's what I'm saying. For my flow, I didn't leak. Maybe if you have heavier flow, I mean, there's more. It demands a lot of, Yeah. But for me, please try it once. Yeah. And the pool has chlorine. Like it has chlorine.
Yeah. Okay. Yeah.
Right. Menstrual cup. Let's talk about that.
Now, mimi nikipata mtu ametumia menstrual cup and can recommend.
Yeah.
Because I've always I've always wanted to know, how it feels. Do you like feel that there's something?
Can I suggest something?
Yes.
I'm also so curious to try. I've never tried.
Yeah.
If I find like a good provider, can we try together?
Yes.
Okay.
Me and Ashida.
I'm on the lookout now. I really want to try.
Yeah, I'm down. Yeah.
Okay. Sawa.
My only problem is that foreign body sensation. You know the way you feel like
yeah. Even for a tampon, I feel like when you wear it, you kind of feel there's something until like you're just like, okay, fine, I can't feel anything.
Yeah.
But it's like you're a bit aware and conscious that there's something in you.
I think that that awareness that awareness is also one of the things that keeps me from using a tampon. Because I'm just like, you're perpetually getting a pap smear.
Please don't traumatize people.
Sorry. I'm sorry.
Actually, and then please, I've remembered we talked about toxic shock syndrome, but we didn't say what it is. Can we explain to the people? Because I think this actually informs them on why, one, hygiene is important, and two, why they need to change frequently. You can't wear a tampon for more than 6 hours. Even 6 unaskuma. Yeah. Tell us about that.
Okay. So toxic shock syndrome. I was about to panic because I was not sure I was going to pronounce it correctly. So it's when a foreign body, like now a tampon, remains inside of the body and becomes infected and causes serious or severe infection known as sepsis. So it happens when most of the time, actually the number one cause is not changing your tampon. Just it remaining there, it's accumulating blood, which is kama chakula ya infection. It's like you're saying
it's
bacteria.
The sweetest, that and sugar. Come. Move closer.
Yeah, So the blood is there. Then this is also a foreign body. So it's not particularly clean. It's not sterile. So it just stays there, and then they just do, a dance there, and they're like, oh,
they're dancing like this as they're
come
calling,
here.
come another one, bring your friends.
Come.
Yeah.
So by the time you're realizing you're having a fever, you're dizzy, you can't breathe,
Yeah.
Then you go to hospital, and you're pumped with fluids, antibiotics, you're still not getting better. Yeah. And then a doctor, like Hope, will take a good history and be like, when was the last menstrual period? And you'll be like, I'm on my period right now. What products do you use? A tampon. We'll go, get a speculum, look at it. And then you'll be like, girl.
It's a tampon.
It's a tampon. It's the tampon that is causing all this. Yeah, you don't have malaria.
Yeah.
It's the tampon.
It's the tampon, yeah.
So that's basically toxic shock syndrome. TSS.
And I think I also saw this story of some lady who actually, I think she had her tampon in for either like 8 to 12 hours. So she got toxic shock syndrome. It's a tongue twister. Toxic shock syndrome. And now, of course, her sepsis now started climbing. So she actually had to have her 2 limbs amputated. I think it was her all her peripheries, like her legs, and I think a part of like her upper limbs.
Yeah.
And I was like, yeah, guys, ladies, it's serious.
Yeah.
Please change your tampon frequently. Please also ensure, if you're using a tampon, hand hygiene.
Yeah.
You wash your hands before and after. It's very important. Because remember, not all of them have the introducer.
Yeah.
So there are some that don't have the introducer. You might come into contact with like the cotton itself. So make sure your hands are clean for that.
Yeah.
Even for a menstrual cup. Yeah. All right. Now, you talked about your heavy periods. You talked about your cramps. Now, when you went to the doctor, the gynecologist, the lovely Dr. Waweru, and you were investigated, did they find anything?
Okay. So let's start from somewhere.
Okay.
So we have said that what we term as abnormal is debilitating pain, heavy bleeding, and heavy bleeding, by that we mean changing a pad or a tampon every 1 to 2 hours. And if you're passing out clots, and if you're bleeding for more than 7 days, that's abnormal bleeding. And if you're having an irregular cycle, for example, if it's shorter than 21 days, longer than 35 days, and if they just don't appear at all, So when those ones are now some of the characteristics, or rather the things, the things that make you, that make a doctor or a gynecologist want to investigate you more. So one of the things that they normally recommend is an ultrasound, which they do, and they look for a number of things like endometriosis, adenomyosis. If you're a little bit older, because that time I was a teenager, but if you're a little bit older, they'll still be looking for things like fibroids and all that. They look for cysts, ovarian cysts, and So basically at that time, nothing was found. But as time goes on, we now understand that endometriosis is in different grades.
Yeah.
So if grade one and two, most of the time nothing will appear on investigation.
Yeah.
But that doesn't mean you don't have it. So it's just good to always keep visiting your doctor or gynecologist.
Yeah.
And especially if you have been escalating on management and nothing has been working, it's good to keep,
Excuse me, sir. Back there, are you okay? Sorry.
It's good to keep on visiting your doctor so that if something comes up, it's found early. So at that time nothing was found.
Okay.
But now we are aware that endometriosis haipatikanangi on scan sometimes.
Yes, correct. Yeah. You actually need laparoscopy to go and diagnose it.
Yes.
And then also there's something that Dr. Sule, so she was here last year, we talked about endometriosis.
Yeah.
This is just a digression. She said sometimes the stage doesn't correlate to the severity. Like you can be in stage 1, but then your symptoms are very severe. You can be stage 4. I think it's 1, 2, 3, 4, yeah?
Yeah.
You can be in stage 4 and your symptoms...
not grade, stage.
Grade stage.
In stage.
We'll put it here.
Yeah.
If we are interchanging the words, we'll put it here.
Yeah.
So severity is not directly correlated to the stage or the grade of the condition. Okay. Now tell us about fibroids and adenomyosis. I think fibroids has been the talk of the town right now. I think Lupita is a very good advocate around it, especially based on her experience. Tell us a bit about fibroids and then differentiate with adenomyosis.
Okay.
Yeah.
Fantastic. So are you ready to see where the cows that were sold?
Yeah, where they went.
The knowledge. Okay. So fibroids are basically non-cancerous growths in the uterus. And there are different kinds of fibroids. There are some that grow, superficially, like hapo kwa wall, outside the wall. There are some that grow inside kabisa.
Yeah.
So there are different types. There are some even that are dangling, Yeah. So those ones are just non-cancerous growths in the uterus. Yeah. And then now adenomyosis is the excessive thickening of the uterine wall.
Yeah.
Actually, adenomyosis is normally compared to endometriosis because endometriosis is the uterine endometrium growing outside of the uterus.
Yes.
But now this one grows inside the uterus and makes the uterine wall very thick. Yeah, thick with a C. So it makes it very thick. Yeah. So that's adenomyosis. Yeah. And both of them, the number one characteristic that they share is heavy bleeding. So you bleed.
Yeah.
You bleed until you say, yeah, I bled. Yeah. And that's because of the aberration.
Hey, wow.
The aberration of the uterus.
Yeah.
So those ones are just disorders of the uterus.
That now influence your periods.
Yes, that can influence your period.
I think why I wanted us to talk about that is because many times we just say, oh yeah, heavier periods, you need a thick heavy duty pad. So like we kind of relate the bleeding to the menstrual product, while we need to be relating the bleeding to your health status. Like what is that heavy bleeding telling us? What are the painful periods telling us? And also for things like adenomyosis, something I was reading is many times it's discovered in like your 40s and your 50s. So imagine you've just been surviving with heavy periods your whole life when something could have been done earlier. And then also for fibroids, it's painful and it's heavy at the same time. For endometriosis, it's mostly painful. Sometimes it's heavy. So it's not just about the product you're using. Please understand that heavy, painful periods are common, but they're not normal, just as Kendi said. Another thing, I keep seeing this trend on TikTok. Oh, anemia girlies, my anemia. And I'm just like, guys, anemia is not a personality trait.
No.
It is not. Anemia, first of all, is a what?
It's an illness.
But it's a symptom. It's not an ill.
Guy, it's a Edit.
Do you remember?
It's a symptom.
It's a symptom, yeah. So you have to find. It's not a diagnosis. Maybe let's put it that way. It's not a diagnosis. So we need to find out what is leading to you having anemia. And for many girlies with fibroids and adenomyosis, that heavy bleeding translates to you having anemia, which is a low blood count. And that should not be your personality. You shouldn't be saying, oh, I'm always tired.
Yeah.
Oh, I'm always this. I'm always this. It's my anemia.
Yeah.
No, we need to find out the cause of that anemia.
Yeah, and it needs to be treated.
Exactly.
Yeah. So it's not a badge of honor.
Correct. The same way painful period is not a...
It's not
It's not a badge of honor.
It's not a badge of honor.
Yes.
You're not like, oh my God, cramps.
No.
Get that checked,
Yes,
girlies.
get it. And get the help that you need.
Yes.
Yeah. And then something we forget is the thyroid. Yeah. We normally forget the thyroid.
Yes.
Yeah.
So the thyroid is a gland.
We talked about it. Don't know. You don't have to describe it.
I was about to shine.
Oh, you can shine though.
No.
Oh, yeah, was that very dismissive?
No. It was not. It was not dismissive because I was not sure what I was going to say.
You're such a trooper. No, but we actually had an episode on the thyroid.
Yes.
So we can actually just refer guys there. But I think a lot of what we see from the thyroid and periods is it either causes you to have irregular periods or actually amenorrhea. Amenorrhea meaning you would have your periods. People are missing periods. Yeah, so those are some of the things we see. So there's always something happening when you feel like something has gone outside your norm.
Yes.
So it's also important, ladies, to know your normal so that you can know the abnormal.
Yeah.
Correct.
Yeah, come on, rock it. Yeah.
Okay. So no, let me ask, between back in the day and now, how differently do you approach your periods?
Okay. Back in the day, I used to just wing it. I used to be like, ikikam imekam. Yeah. But now I'm tracking it.
Okay.
I have what we call a period journal.
Okay.
Yeah. Because it's something that is known that your periods are never the same. Your previous period, is not the same as this one. So it's good to just track your symptoms. Yeah. So you say that this period, I almost stabbed someone with a fork. Oh my God. So my moods were extreme.
Yeah.
The next period is that it was particularly heavy. Yeah. So that even when you are going for a review or to see your doctor, you have something to say. Ukona content.
Hey.
Yeah. So I even encourage my patients. Yeah. Track your symptoms. Track your symptoms. Whatever it is, it doesn't have to be even for period. It's period related.
Yeah.
Just track your symptoms. So I track my symptoms quite well. I also track my days quite well. And then I have some preventative mastyro.
Are you preventing the period? What are you preventing?
No. I'm not preventing the periods. So, for example, because I have very painful cramps. The day before, because out of everything, I think God blessed me with a very regular period. It's like
clockwork. Yeah.
So it's a 24-day cycle.
Okay.
So on day 23, I'm like, is that Gofen? Come. Is that paracetamol? Come. Kuja. No, umenda wapi? Kuja. Yeah. So I take the meds on day 23. Okay. So that at least it's a bit comfortable on day 24. I also buy my products on time. Okay. I don't wait until last minute because there's just this thing that it's like someone is sensing that your period is almost, and so your products go out of stock, and I'm like, wow.
Have you ever had a mishap? Okay, like have you ever leaked in public?
When I was a bit younger. Okay. Yeah, but nowadays tukona mastyro. Yeah. Tukona mastengo. Yeah, could prevent leaking. Yeah. Because that used to be a problem. And I never used to understand why. But then now, when you get good pads that fit you and basically your flow, that helps. And also the night ile ya waking up in a pool of your own blood. Hata hiyo tulipata mastingo. So it has improved. Okay. It has improved.
I think I remember this one time I leaked in med school. Like, no one knew. I think my pants were dark. Yeah. And I was just like, this is the worst day of my life. Yeah. And I was just like, why do you feel like that? Like, what can you do about it? Like, yes, you knew you were on your periods, but then it's just an accident.
Yeah. But there's so much, I still feel that there's so much shame surrounding periods. Because, again, men are still icky about that topic. You know, they're like, oh my God, is that a pen? You know?
I carry my pads like this, by the way, these days. I'm just like,
Same. And I'm like, Nico nayo.
Nico Cardi.
Na padi.
Oh my gosh, that's a slogan.
Nico Cardi na padi.
Hey.
Yeah. So guys are still icky about it, and then women are still hiding it like it's a secret. It's not a secret.
Yeah.
It's a life-giving process. Yeah, because without your periods,
It's
a life-giving process.
Correct.
So without it, you know.
Although it's saying next time, not this time, but next time maybe try again.
Yeah. Announcement.
Yeah.
You have nothing. So. So basically, it shouldn't be a secret.
Yeah. Okay.
And I get our moms are very conservative, so they're like, yeah, nobody should know that you're on your period. And I get that because they grew up at a
different time.
It was different during that time. But sasa sisi.
Hey, too.
Hakuna kitu ya kuficha hapo.
That's true, by the way. And I feel like the more you educate the men, the more they're also able to help us, around that time.
Yes.
Yeah. I keep seeing this thing. I feel like it goes and comes back. It's a TikTok, a trend, I think, on social media, where you send your male partner out for pads with wings.
Oh, gosh.
And they bring pads and wings. Chicken wings. I'm like, Kwani, Amjiwangi pads have wings. Like, they have wings.
They have wings.
For holding the underwear.
That one is a deal breaker for me.
Really?
It's a deal breaker for me. I send you out and then you come with wings. Table. The door is that way. It's that way.
But then does it ever occur to you they were never in the room when you were being taught about your menstrual health?
Okay. Me, I'm not hating.
Yeah.
But I feel like men have that kutojituma. You know, hawajitumi. Like now, fine, you're not a woman and you cannot relate. But you're with a woman.
Okay. You need to learn how to relate.
Can you learn? It's the same thing. I will give my dad his flowers when he's still here with us.
Yeah.
He's a girl dad. He has 3 daughters and 1 son. But mostly 3 daughters, yeah?
I didn't know you have a brother.
I have a brother.
Oh.
Hi, Gambi.
Hi, Kiogora's brother.
So, this man knew all our products. Like, because we used to use different. Moja natumia always, mingine Cortex, mingine anga Stay Free.
Yeah.
So he used to know.
Okay.
Yeah. And he used to be very supportive. Like, he would be like, okay, the cramps, you'd get like a hot water bottle. Like, he learned.
Yeah.
He learned. He was never there in those health education talks.
Yeah.
He was never there, but he learned because now he can't do anything about it. He has daughters. So I think men wanafaa kujituma.
Okay.
And not just sit back and be like, oh my God, periods. No, learn something about it. Don't be icked out, you know. Ask your girlfriend questions or your partner or wife or whatever. Ask them questions. Ask them, how can I be there for you? How do you want to be supported in this bloody situation?
Yeah. Correct.
Ask the right questions.
Yeah.
And don't just be like, oh my God, it's Shark Week. I gotta get out of here. Where?
I know.
Where?
So now you're sick.
Tutakutupa. Yeah, so no. Yeah, so I feel like there's that kutojituma.
Yeah. Let's continue to educate them because I also feel that, sometimes when you get this question, so how do you pee when you have a tampon?
Hey.
Let's go through the anatomy. Take us through Daktari.
Sasa.
We'll put an accompanying image on the side.
Yeah. Shimo
ni tatu.
Shimo ni tatu.
Uh-huh.
And I'll look in the camera and I say this. So I go, yes, but shimo ni tatu.
Yeah.
So a lot of people don't understand that anatomy.
Yeah.
Because women's anatomy is different from men. The men, where they do the masusus is where everything... is where everything happens. Yeah. But women have the urethra.
Yeah.
And then they have the vagina, and then they have the backside,
Yeah.
the anus. So when you're on your period and when you're putting on a tampon, you put it in hole number 2. Okay.
The vagina.
The vagina.
Vagina. It's a normal word. Let's get comfortable saying this word.
Yes, you put it in the vagina.
Yes.
Then when you're going to do the masusus, it's in hole number 1, the urethra.
Yes.
So it has got nothing to do with hole number 2. And it's the same thing what I tell my patients. There's a difference between an STI and a UTI. Because most of them are just like, oh my God, I have an STI.
Yeah.
And I'm like, explain STI. They're like, I'm feeling pain while urinating. I'm like, girl, sit down. Sit down. Sit down. I have to tell you something. Yeah? Let me tell you something.
Let me tell you something. Oh, Linda, listen, Linda.
Yeah. So for men, you know, and a urinary tract infection is treated as an STI until proven otherwise.
Yes. Yeah.
But for women, it's distinct. A UTI is very distinct from an STI. Yeah, and they have very different presentations.
Yeah.
So so you can pee with your tampon very well.
Yeah.
Yeah. The only thing is maybe that kandigi, that string.
Yeah, it'll touch the string.
It'll touch the urine, will touch the string. But other than that, uko sawa.
Correct.
Yeah.
All right. Sasa ya kufunga. Periods and the workplace. Do you guys have menstrual leave or period leave? Madam manager.
This is a thing. It's a personal practice for me.
Okay.
That if a woman, whether a staff in the workplace or even a patient, if they come to me and they have cramps, severe cramps, I will give them an off. Because even if they go to work, they will not be optimal.
Yeah, they're not productive.
They'll not be productive. So why are you doing this to the girlies? Yeah. So I tend to be very compassionate. Yeah. So I will give someone a sick leave for cramps.
Okay.
And also depending on the severity.
Yeah.
But also at the back of my mind, I'm also thinking that this person is bleeding. Yeah, this person is probably moody. This person is in pain. That and work, no. Yeah. But I can see even Governor Dimples has introduced, is it in Nairobi?
Yes,
Nairobi
County.
Yeah. So it's something that is worth exploring, just not in Nairobi, because women don't live in Nairobi only. Can we
Correct.
Can we spread it?
Yeah.
And just go further. Like now Scotland is the first country to introduce free menstrual products.
Wow.
Yeah.
Wow.
And then Spain has officially put it into law that women can have
menstrual leave.
Yeah. So those are progressive, agendas.
The ones you want to hear more about.
We want to hear more about.
Yeah.
Because this is the core being of someone. This
of
is
a woman.
it's of a woman, and the woman is the backbone of every society.
Let's have it.
So basically, we support a woman. We have supported the community.
That's true.
We supported the community.
That's
so
true.
Those are the things that we need to look at.
Yeah.
We need to get period rooms. By period rooms, I mean a place where someone can akifinya finyo hapo na.
Girl, explain yourself.
Okay. Akiduga.
Oh, when they're cramping.
Na cramps.
Okay.
Yeah. They can go and lay down. No.
Yeah.
They can go and rest.
Yeah.
So if we can have that in the workplace, just like the way a lot of organizations now are introducing breastfeeding rooms and all those rooms, can we introduce a restroom?
Yeah.
Not restroom there, like chore, but where you can go and rest when you're having, cramps and maybe you are too busy to go to the, clinic or to hospital. So you can just take some meds and just sit down and calm yourself, and rest kidogo and then go back to work.
That's true.
Yeah. So those are some of the progressive things that we should be thinking about.
Yeah. Having experienced menstrual leave or period leave, I highly recommend.
Yeah.
Yeah, it was just one day in the month and you could take it. So it was literally a company rule that every lady gets at least one day of the month as period leave. So the idea is for you to take it on your worst day.
Yeah.
So that at least you have that time to just recoup, rest, and then come back the next day when you're able to be more productive.
Yeah. And I feel like you shouldn't go to hospital to get a sick leave.
Yeah.
It should be incorporated in the organization.
Exactly.
Like the way you take your annual leave.
Yeah.
You go there and you're like, oh, period leave.
Yeah.
Yeah.
That was actually paid.
Yeah.
Yeah. It was a paid day.
Yeah.
Yeah. So you just take it comfortably. Just make sure you speak to your manager, your line manager,
Yeah.
and inform them that you'll be taking period leave on this day. Yeah.
Yeah.
Mm.
And that's fantastic. Yeah,
It
tuambie
is.
your organization gani so that go there.
Stronger candle.
Yeah.
Yeah. Lakini umesema vitu mingi.
Yeah.
Before we now go back to the closing segment, what are like your common symptoms as Kendi that you experience either in your luteal phase? Because of course menstruation, the menstrual cycle has different phases.
Yeah.
The first one being menstrual, then we have ovulation on day 14. Then after that we have the luteal phase, which is where everything that can go wrong goes wrong.
Murphy's Law.
Yeah, that's the one. You don't want to see anyone.
Yeah.
You're hungry.
Yeah.
And then now you have your period. So your periods are the start of your cycle.
Yeah.
Yeah. So for you, what are some of the common symptoms that you have around
I
your
usually
luteal
have-
phase to your like
yeah.
your periods?
I have PMS. I don't have PMDD, but I have PMS. So
Okay.
PMS is premenstrual syndrome.
Yeah.
Then PMDD is pre
Menstrual dysphoric disorder.
dysphoric disorder. Yeah. So PMDD is basically a severe form, very severe form of PMS. Yeah? So when in PMS you're having like a mood swing, in PMDD it's depression.
Yeah.
It's full blown depression. You know.
Yeah.
Yeah. So I tend to have raging mood swings. Raging mood swings. Hiyo sitadanganya. And if somebody has witnessed them or experienced them, please do not comment in the comment. The comment section.
Sikupenda kwake.
Sikupenda kwangu.
Yeah.
Please, it's the cycle of life. Yeah.
Oh,
Yeah.
she said it.
So I tend to have very severe mood swings.
Yeah.
And they are accompanied by tears. My mood swings are like me nakwanga ka baby crier.
Yeah.
So even if like let's say a patient asks me like I've not understood, please repeat. I'm like, when you don't trust me.
That's why you need to be at home.
That's how I'm usually like, cut, I need to go. I
got
got
the
to go.
Yeah.
So I get very emotional and I cry quite a bit. If someone hoots at me kwa barabara, I'm like, why would you do that? I'm just a baby.
Yeah.
So mood swings. I have fatigue. And I've learned to schedule my activities. Hey, hii kitu nimeigonga.
It's okay.
I've learned to schedule my activities
Yeah.
based on my cycle.
Okay.
Because now if I'm meeting people,
Yeah.
it's not in the luteal phase.
Okay.
Yeah, because they'll just say something like, you have a pimple, and I'll be like,
I'm here and that's all you've seen.
yeah. So yeah, fatigue,
Yeah.
irritability. Yeah, so those ones are usually the predominant ones.
Okay.
Yeah, and
Okay, and cramps.
and cramps,
Okay.
and excessive sleepiness.
It's true, by the way, that
Yeah.
fatigue, I don't understand it. I think for me, the thing about my periods, they've really changed over time.
Yeah.
I think when I started my periods, up until like my mid-20s, that fifth year of med school, I think med
Yeah.
school actually made my periods do aka.
Yeah.
Yeah.
Whereas-
That first time period, I didn't have any like it was just okay. Like they come, it's okay, no cramps, no nothing.
Yeah.
You wait, I clocked, I think it was like 23, the PMS. I always just knew this a day, well, I'll have bad mood swings.
Yeah.
The next day, like clockwork, periods
Yeah.
are there.
Yeah.
Yeah, so I usually have like PMS as well.
Yeah.
I have a bad mood swings where I'm just, hey, Nico too, but then also don't piss me off.
Yeah.
Like don't piss me off.
Yeah.
And then you schedule time for crying. My crying
Yeah.
hours are midnight because they're just so sweet.
Yeah.
So you just put some music on YouTube. And then you
Yeah.
just lie in bed like this and
Yeah.
just let the
And
tear
just
roll
cry,
down.
and just cry.
Yeah. And then I think irritability as well, but the fatigue and the hunger.
Yeah. Oh, girl.
What?
Yeah. That's a
Hey.
time to add weight.
Wow.
It's a time to add weight.
Yeah. That one, I think those two are the ones I've just never understood. Like, why do I
Yeah.
get so exhausted and so tired? There's a time I actually went and had my HB checked because I was like, is it that I'm anemic? I'm not
Yeah.
understanding what's going on. Or
Yeah.
like my glucose, am I hypoglycemic? Kumbe ni luteal phase.
You look your face, and you're just like, that day drained me.
For real.
Today drained
Today
me.
drained me. Hey.
Yeah.
Yeah, and then I've tried cycle syncing, which is what you're saying. Like now arranging your activities according to your cycle.
Yeah.
But I only do it for like working out.
Yeah.
Because of course luteal phase, especially just near your period. Sina nguvu wala uwezo.
Yeah.
So I just do my walks and maybe just a bit of like strength training.
Yeah.
Yeah, and that's it.
Yeah, for sure. Yeah.
But
Okay.
mimi si kama ni like I have cramps, but
Yeah.
only on like day 2, and they're not debilitating. So I really understand when you're saying we need that care,
Yeah.
tender love and support.
Yeah.
Yeah, it's very necessary. Okay.
Yeah.
So Masawa, is there anything else about periods that you want to talk about? A parting shot on this topic before we move to the last segment?
Okay.
Yeah.
So I think we've already said that some of these problems, issues, they are common, but they're not
Normal.
they're not normal, and it's just not enough to manage some of these symptoms. They need to be investigated, because people will come and be like, "Can't you stop my bleeding?" And I'm like, "Girl,
Yeah.
that's not enough." So they need to be investigated.
Yeah.
So even as you go to the hospital, just have that mindset that you need to get to the bottom of it. What is causing all these things?
Yeah.
So yeah, and take care of yourselves, girlies. Out here, it's insane.
No one is gonna take care of you.
Help is not coming.
It's not coming.
Help is not coming. So actually, let me put this parting shot vizuri. The body whispers before it shouts.
Oh.
The body whispers before it shouts. So a lot of people wait until the body shouts, and most of the time it's already too late. Their conditions have maybe gone a bit, over. Have progressed. And this is just not for periods, this is for everything else.
Yeah.
Please listen to your body.
Yeah.
If something is aberrant, suddenly, look into it. Yeah, that's the body whispering. That's the body being like, check engine. Usingoje gari isimame kwa
you
katikati
just
ya
need one
barabara.
emoji light on. Not all of them.
Not all of them, just one.
Yeah.
Just go check it out. Don't wait for your body to shout or to scream. When it has been whispering all along. Okay.
Correct. I think for me, it'll just be around family planning. Please ask your doctor the questions, especially if you're on hormonal family planning, and also the copper coil, because it tends to affect or influence your periods, especially the first 6 months, because for hormonal, of course, your hormones are still adjusting. So just ask them about the question, about the changes you should anticipate with your period, so that at least you know when to seek care, and maybe if this is not the best method for you, then change to another one. But please ask the questions, because family planning is one, hormonal family planning especially is one of the things that can alter your normal period. All right, sasa, beyond the clinic, sasa tumeacha hiyo. Beyond the clinic. It's still a bit health related, but it's beyond the clinic.
It's beyond the clinic.
Yeah.
Okay.
So, if you could text your patients one piece of health advice, actionable health advice right now, what would it be?
Prevention is not only better than cure, it's cheaper.
Hey, look at the camera and say that.
Hello. Prevention is not only better than cure, it's cheaper than cure. Yeah.
Health is wealth.
Yeah.
All right, correct. Next question. What's the first thing you do for yourself in the morning, or the last thing you do for yourself in the evening that's just for your sanity?
Okay, so in the morning, sikwangi nimeload.
Okay.
So there's nothing much I do. Like, I just preserve. Just like this. So I just preserve that energy to get work.
Okay.
Yeah. But the last thing I do at night before I go to bed is probably listen to an uplifting song.
Okay.
Yeah. And maybe read something. Just read something before I go to bed. I made it a habit to read something new every single day, just to keep myself either informed or entertained. Just read something.
Okay. Nice. I had purpose to learn something new every day this year. I don't know where I am, but I was doing well. I was doing well. Can you clap for me? Thank you. Then the next question is, what is one thing that the body does that you're just like, that's so wild? Like, why would you do that? Or how have you done that?
Autoimmune diseases.
Why are you fighting me?
I'm like, I'm not the enemy. I'm not the enemy.
Wrong target.
No.
Yeah.
It's very funny to me.
Yeah.
How the body can just wake up one day and is like, you are the enemy.
Yeah.
And I'm going to fight you.
Yeah. Yeah.
So your immunity that has been protecting you all along is now just like, you know what? The door is that way. We are finishing you today.
Yeah. It's so unfair. Like,
autoimmune is something that I'm just like, then the body up imejaribu.
Imejaribu in the wrong direction.
Imejaribu in the wrong direction.
Yeah.
Yeah.
Okay.
Yeah.
That's nice. I was talking to, so we filmed a previous episode.
Yeah.
And now after the episode, now one of the guests was just like, I should have said this one. Imperforate anus. Like, why would you develop without just ensuring the anal orifice is open? Like, it's just so unfair.
I don't know why I find that so funny.
It's so unfair,
It's
honestly.
unfair.
Yeah.
Okay. I'm
I
sorry.
was like, finish the job.
Yeah.
Ugh,
Just
yeah.
Malisa too.
She said that and I was just like, Kanye, like, why?
Yeah.
Yeah. Okay, next question is, what's a piece of health advice that you used to subscribe to that you no longer subscribe to?
A piece of
Health advice.
Yeah. That now which one? I can't think of one right now.
Okay.
Oh, I think of one. I can think of one.
Mm-hmm.
Like not using panty liners often.
Okay.
I was just like, get out. I use panty liners every single day.
Okay.
Mostly because it just helps. It just helps. Sometimes you don't get to the toilet.
Girl. And you're just like, oh damn, but you're like, oh, the panty liner.
The panty line is there.
Okay.
So that one is it's a rescue mission. So
Yeah.
I was just like, you know what? Listen. The panty liner is staying.
Okay.
Yeah, it's staying. So it helps
Okay.
quite a bit.
Yeah.
And sometimes when things are unpredictable, even like with your menses, that time you think that it is over.
But it's not.
But it's not.
That's like the worst.
Yeah, so it stays there. It stays there. So it's one of those things. I can tell my patients don't use panty liners every day, but me, I'm at the back of my mind. I'm like,
We say as doctors, do as we say, not as we do.
Yeah. So panty liners,
And I think now that you've mentioned that, it's very important to tell young girls it's okay for your panty to have panty stains.
Yes.
Like, first of all, your vaginal fluid is acidic.
Yes.
So if you have a black underwear, it literally is bleach.
Yes.
It'll bleach that underwear.
Yeah.
Sometimes you leak. Hey, someone is fighting with their door.
Someone's about to
Someone's
die.
fighting with the door.
Yeah.
Are you kicking us out so soon? No, but for real, it's okay for your underwear to have stains.
Yes.
Like, accidents happen.
Yeah.
It's okay.
Yeah.
Okay. Then the last question is, what's one health rule? When I say rule, I feel like people don't usually get it. What's one health rule that you think we should break every now and then without feeling guilty?
It's something sweet.
Okay.
It's something sweet.
Yeah.
Sometimes even the body asks for it. It's like, oh yeah, you can have what is it called that day?
A cheat day.
A cheat day. Imagine just eat something sweet.
Yeah.
Yeah, you won't develop diabetes.
Yeah.
When you space out your sweetness.
It's about moderation.
It's about moderation. So eat something sweet, because I've found people who have no sugar whatsoever in their diet. Like they just look at something and they're like, iko na sukari, never. I'm like,
it's okay.
Utapata energy kutoka wapi?
Exactly.
Yeah, so eat something sweet.
Okay.
Once in a while, eat something sweet. A cake, a donut. Yeah.
Pastries. You know, pastries are my weakness.
Yeah.
Wait. Like sometimes I crave them, like, I want it now. Like, I want it now.
Yeah.
But I agree with that. All right, tumefika mwisho our yap session.
Tumefika tamati.
Sio tamasha? Okay, tamati. If you want to be found, the camera is yours. This is your time to plug yourself. Yes.
Okay.
If you want to be found. Are you private, by the way?
No. Am
Okay.
I'll check.
Sawa.
I'll check.
Okay, but plug yourself.
Oh, okay. So for the audience, this was just like a conversation. But
Yes.
if you have a burning question, if you have something, if you want to be helped, like if you're having an issue and you want to be helped, you can always find us. If you don't find me, because I'm I'm just out of social media, because I'm just like, listen,
Which is fine.
Listen.
Yeah.
DM Hopi first.
Yeah.
Follow her, subscribe, DM, then you DM Hopi and be like, that chick who was always talking on your podcast, I'd like to see her. Then she'll
I'll
plug
direct
you.
you.
Yeah. But if you want to look for me and find me, my handle is what's my handle?
Kiogora.
Kiogora. Yeah, just Kiogora Kendi.
Yeah.
DM me. Then we can talk from there.
Yeah.
Because I believe that sometimes people don't know where to start.
Yeah.
And as doctors on social media, we kind of have that obligation to guide people.
Yeah.
So we can always get some help from us.
Yeah.
Yeah.
Correct. Now that you've told them to subscribe, I will not repeat.
Yangu
ni kusisitiza.
Yes. Yes.
Yeah. But my name is Dr. Hope Simiyu. Thank you so much if you've reached this far. Clap for yourself. Correct. And of course, please follow us on Instagram and TikTok. Also the podcast on Instagram and TikTok. Subscribe if you haven't. But subscribe if you haven't. And even on Spotify, Apple, Amazon, wherever you listen to your podcasts. And that is a wrap.